to ask questions of the presenters. You can find that. And it does enable you to ask your questions anonymously if you prefer that. The chat feature will be active only during the Q&A unless our tech folks decide to turn it on sooner, at which point you will be able to use that. We are going to send a PDF version of the initial part of this presentation today, so don't worry if you don't capture all of the LLS information. You'll have time to review that later. And lastly, please complete the evaluation that's going to be sent to the email you registered with. That helps us to plan future programs. And just as a little incentive, we're going to do a raffle and send out gift cards to the 5 winners that we pull. Next slide, please. All right, and now let's see, a word from our sponsors. Let's see if they're on today. They may not have joined just yet. All right, so they're not yet joining us. So I would just like to say thank you to Nemours Children's Health. It's because of them that we are able to do things like this program. So we're very appreciative of their support. Next slide, please. Thank you. I'll now take a few minutes to share some general information about our support resources. For the sake of time today, I am going to go rather quickly, but I want you to know that everything is on our website. And here on this slide, I noted with 2 arrows where you can find resources, particularly for young adults and children, assuming that is of particular interest to this audience. So you see a lot of information and really cool programs and resources that we offer. We are the largest nonprofit dedicated to supporting those with blood cancer, and our mission is to cure blood cancer. So we're a pretty ambitious group of folks. You can see a wide range of resources we offer here. You can think of our services in 3 buckets: emotional, financial, and educational support. The best way to connect with any of these resources is to call that 800 number in the middle of your screen. And we'll talk to on the next slide where that will take you. So next slide, please. If you call the 800 number, which is the most important thing to remember from anything I will show you today, our resource number, you'll reach our resource center. That is staffed with master's level trained adult and pediatric oncology social workers, nurses, and health educators. They can answer disease and treatment related questions, and they connect you with support and resources offered by LLS, or if need be, by another organization locally. They can speak to patients and caregivers in over 100 languages using our language line, and can also connect you with unique resources such as our Clinical Trial Support Center, which is another incredible resource that we offer. This slide offers details about our financial programs. You will have this in your follow-up email, like I said, so you can review it at that time in more detail. But I do want to note here that our financial assistance awards run the gamut from anything starting at $100 to our brand new medical debt case management service. It's an incredible new service I encourage you to check out on our website. And again, this can all be found at the link on the slide you see at the bottom, www.ls.org/finances. In the next few slides, I'm going to show you some very cool pediatric, adolescent, young adult specific resources that we have. You can get these resources sent to you or download them. If you want them sent to you, many of these are accessible, if not all accessible, by calling that 800 number. So you see here the First Connection program. We can match parents and caregivers with other parents and caregivers who have been in a similar situation. This is one of our most popular programs. Those of you in the program will connect with one of our over 800 volunteers across the country and have that 1 to 2 time phone call, which people find to be incredibly helpful. We also have our LS community, where if you're not wanting to talk to someone on the phone, you can join our online community, connect with people from around the country with particular questions with any area you can imagine: nutrition, caregiving, pediatric cancer, et cetera. And it's a robust discussion community that you can engage with that way. Next slide. This is a very busy slide, but these are just some of the many things you can download for free or have mailed to your house for free from our website. That includes our Teens Guide. It's a teens magazine that helps teenagers process their experience of going through cancer as a teenager. Next slide. And then some really exciting stuff. We have various things that continue to develop over the years. We have a dry erase board to manage appointments, a parent in the field actually designed a Medi-Teddy that goes over a child's IV bag. We have a book trilogy that chronicles a child's experience from being diagnosed, going through treatment, and then returning to school. We have coloring books. We have apps for kids while they're waiting in the waiting room. And for those that are having a little trouble expressing emotions, we have our Whiskers flip chart book, which helps kids to point to how they're feeling and communicate with those around them if they're not feeling like they want to communicate so much verbally at that stage in treatment. The next slide shows our examples of some of the podcasts that we've done around caregiving and cancer. So I encourage you, this is a free podcast. You can listen to it while you're driving. I know everyone is busy. These tend to be anywhere from 20 minutes to 40 minutes. So they're pretty manageable in that way. And they too are on our website. And then the last few slides and some things we offer that are pretty exciting. One includes our nutrition. So you can schedule a free nutrition consultation with our nutrition service. You can also have podcasts. We have a nutrition handbook for parents. We have food fun for things to use with their children. It goes on and on. So I just want you to know that that too is available. And then the last two things I want to mention here is if your child's going back to school after treatment, we do have resource. It's actually a CE credit course for those in the school system that can help prepare them for having the child come back into the classroom. You too are welcome to take it if you are a parent or a caregiver. And then last but not least, before we go into our Dare to Dream slides, I just want to share with you our LLS scholarship, which is on the next slide. Our LLS scholarship is somewhat new. It offers up to $7,500 for funding for school. And this is for folks that are diagnosed before the age of 25. So be on the lookout. August 1st, 2025, applications will open. All right, now to talk about our exciting Dare to Dream project. You see some pretty alarming statistics at the top of this slide. 40% of all childhood cancers are blood cancers. 80% of childhood cancer survivors develop one or more chronic health conditions as a result of their treatment. You can read the rest here. So ultimately, the message is that we need safer, less toxic, more effective treatments for children. And LLS is trying to change that. We are trying to change the drug development paradigm for pediatric blood cancers. Our goal, you'll see on the next slide, is to revolutionize the standard of care for pediatric blood cancer patients. So to that end, LLS is investing well over $100 million over the next 5 years to fund what we are calling the Dare to Dream project. We have the goal, like I said, of revolutionizing the standard of care for pediatric blood cancer patients. So if we go to the next slide, well, how are we going to do? We have research and clinical trials, policy and advocacy, education and support. We are focused heavily on all of these components because we know that's what it will take. We've invested over $100 million in pediatric research since 1949. We have funds allocated. We have more than $52 million in funds for multi-year pediatric research grants through fiscal year 27. We've already seen the wide rate of support and education and resources we offer, but I want you to know that from the advocacy standpoint, we need to make sure that kids can access these treatments and that new treatments can be accelerated. And so we are working with state and local governments and national government to ensure that policies support the work that we are doing. The last thing I'm going to show you before we go into introducing our first presenter, I want to tell you about the PEDAL trial because it's truly incredible. The PEDAL trial, pediatric acute leukemia, in June 2022, LLS launched the PEDAL Master Clinical Trial. It is the first integrated global acute leukemia master clinical trial to test new, safer therapies on children who will be matched to treatments based on their unique tumor biology. We could have a whole presentation on just PEDAL, so I encourage you to check out our website for more information. But I will say that we have over 200 clinical sites in the United States and around the world right now. It's very, very groundbreaking, as I said. But I do want you to just see this short video, which explains it much better than I ever could. And then we'll go into introducing our first speaker.
The PEDAL project is an acronym for Pediatric Acute Leukemia. So PEDAL is a collaborative effort in the United States and in fact globally to bring new therapies, safer therapies, forward for children with blood cancers.
The PEDAL Master Clinical Trial offers an opportunity for us to rethink how we study new therapies for children with leukemia. It's a paradigm shift. It's a transformative effort that's going to redefine partnerships with academia, partnerships with regulatory authorities, with our funding agencies, and with our industry partners so that we can bring new drugs to kids faster. When a child with leukemia relapses, it means that our standard therapy, our best available therapy, has failed them. So we need to be very wary of how we're delivering drugs to kids, making sure that we're giving them drugs that have a potential for benefit, and making sure that we're studying them in a way that we can learn, not just to help the kids we're treating today, but to help the kids we're going to treat in 10 years, 20 years, 30 years down the road.
One of the biggest problems we have in pediatric oncology is that when kids relapse or they have refractory leukemia, it often takes us a long time to figure out what else we can treat them with. The goal with Gearbox is to get a kid on a trial within 2 to 3 days. So what Gearbox does is it pulls all the information from the clinical trials website that the government runs, and it takes all that information and it puts it at the fingertips of the clinicians so that they can quickly put in criteria about their patient and immediately see which trials might be potential matches.
The collaboration between AbbVie and the Leukemia and Lymphoma Society on the PEDAL Master Trial protocol is really through AbbVie providing our innovative, novel, targeted agents that we are developing to treat various blood cancers. I think one of the beauties of the collaboration between pharma and the Leukemia and Lymphoma Society is the power of this organization and its ability to run research around the world.
The Pediatric Acute Leukemia Initiative, sponsored by Leukemia and Lymphoma Society, is the most impactful initiative for the treatment of really hard to treat leukemia that I've ever experienced in my career. We're still using the same chemotherapies over and over again for the last few decades to treat children whose leukemia has come back. And finally, we're able to use the potential of all our new diagnostic technologies and match patients to the correct treatments. PEDAL means so much to families with cancer and leukemia in particular. It really represents hope to these families and the feeling that they're not leaving any stone unturned for the treatment of their child.
That gives you a little insight into the PEDAL trial, and why I'm so excited about it. There is also an absolutely adorable video. These children are amazing. There is a video on our website for Dare to Dream, which I wish I could have shown as well. And now to get to one of our main speakers, Dr. Silverman. I'd love you to turn your camera on if you are with us. Dr. Silverman is a pediatric hematologist oncologist at I knew I was going to mess this up, and I practiced. Havnanian Children's Hospital in Neptune, New Jersey. He was born and raised in Staten Island, so a local New Yorker, and he attended undergrad college at Stony Brook University in Long Island, followed by medical school at Downstate Medical Center in Brooklyn. He was actually originally intending to be a pitcher with the New York Yankees, obviously, but it was a fateful rotator cuff tear while trying out for his high school varsity basketball team that led him down the path of medicine, and we are grateful for that tear, Dr. Silverman. Though his original medical interest was in surgical treatment of bone and soft tissue cancers, he was immediately struck by the children of the Pediatric Hematology Oncology Ward while partaking in a rotation at Memorial Sloan Kettering Cancer Center. This revelation led him to pursue a residency in pediatrics, followed by a fellowship in pediatric hematology oncology at the Columbia University Medical Center. He pursued lab research into immune-based therapies for cancer. He published articles exploring the immune system's role in brain, eye, skin, and colon cancers. After training, Dr. Silverman wanted to return to a more clinically focused role, with patients and their treatment being a primary focus. He finally joined the burgeoning Pediatric Hematology Oncology Group at KHOV, where therapies were being brought to children with all sorts of blood disorders and cancers. As part of his group at this hospital, he is partaking in clinical research studies focusing on optimization of treatment for a variety of cancers, including leukemia and lymphoma. But in a more direct way, Dr. Silverman, also known lovingly by some patients as Dr. Blippy, makes a point to involve children in their care. From the infants and toddlers unable to really understand their illness or its treatments, to the older teenagers learning to be active participants in their life's decisions, Dr. Silverman focuses on bringing some levity and joy to what can be an extremely challenging process of overcoming cancer and treatment. From his hilarious dad jokes to his stupendous dance moves and exceptionally stylistic fashion choices, Dr. Silverman gives his patients, and by extension their families, the opportunity to forget, at least momentarily, about their medical situation and enjoy being kids, even through the challenge of a lifetime. Dr. Silverman.
Hi, everybody. Good afternoon. I'm going to see if I can share my screen. I have a presentation here. Maybe if I do it this way. Um, okay. Okay, is that working? Are you able to see this one?
It's still, yep, we can see it.
Okay, cool. All right, I think it looks a little bit funny, but bear with me, and I apologize if you hear my newborn crying in the background. So yes, I'm Dr. Andrew Silverman. I'm a pediatric oncologist and hematologist at Jersey Shore University Medical Center. And I was invited today to speak, and I appreciate that invitation, on the role of humor in the treatment of cancer, blood cancers, the coping with these diagnoses and so forth. So here is, there you go. There's a formal picture of me, happy as always. But the patients almost have never seen me wearing a tie. I think I've worn a tie one time, and it was specifically for this picture. And a suit jacket, I think I've worn twice, once for this and once for the Little Heroes prom a couple years after this. What patients will more likely recognize me doing is like back here. You can see me in the back there cheering on my patient as she finished her treatment for leukemia. You could see me here. You can try to figure out which one is me. It's a little bit difficult, I know. I blend in nicely with the rest of the people here. And you could see me over here. Let me move this thing, sorry. Okay, and you can see me here interacting with a patient recently at a charity event, and the siblings of a patient recently, after I walked a half marathon with them to celebrate the life of their brother who had unfortunately passed away of a blood cancer. And then here you can see me in my natural habitat wearing my wig and nose. I'll leave that one as it is. So where did I get the inspiration to involve humor and how do I incorporate it into my medical practice? Well, I think that many of us here, assuming at least most of us are millennial or older, have seen the 1998, I believe, film, Patch Adams starring Robin Williams. Obviously, for those who have know what this is, basically he is a pediatric, or excuse me, he's a family medicine doctor who is involved with patients who have cancer. And obviously, there's much more to the story. But one of the big things that I found particularly notable about this movie is that he incorporates humor, right? He acts as basically a clown in the way that he takes care of patients, and yet he's a very knowledgeable medical provider. I like that concept, and I've always incorporated it into my real life practice. Now, for this conversation today, I looked a little bit more into the real life Patch Adams, who I will mention has his real first name is Hunter, which is my son who's crying somewhere upstairs. That's his middle name, not related to this, but here we are. Nevertheless, the real life Patch Adams has a little bit of a different story. He uses mostly integrative medicine as his treatment approach. He's not actually an oncologist, as I had remembered based on the movie that I watched 26 years ago. Nevertheless, the point is still well taken that the incorporation of humor into the role of medicine is actually a very important thing and something that there's a lot of data to support. This is real life Dr. Adams's Gesundheit Institute, where he takes care of a bevy of different disorders, mostly without using medicine and also free of charge. It's very interesting. There's a lot of TED Talks that this guy does. I think that it's really interesting. People should watch it if you have some time. Nevertheless, my own story or my own use of humor in medicine began pretty much right from the outset when I was in residency. I became ill myself. I have multiple sclerosis, for those who know, and those who don't know. Part of that condition, I was hospitalized at the very start. I was a second year resident at the time. And one of the major symptoms that I was experiencing, amongst other things, was that I lost color vision, which was weird, or a weird thing to experience. And I had a doctor who came in. She was a resident. I think she was an intern, or maybe she was a second year resident. But she's the main thing that I remember from that hospitalization, other than, of course, the treatments and the things that were going on to me. But she's the one doctor that I remember. And why do I remember her? She came in. She was wearing a dress. It was red. It was orange. It was yellow. I don't know, something like that. Again, colorblind. And she asked me, "What color am I wearing today?" to test to see if my vision was getting better. Of course, I did not know the answer. I took a guess. Apparently, my wife just informed me that I guessed red, and apparently I was correct, but I didn't really know. Point of this is, every day she would come in and with some sort of funny little thing and play a little joke with me, and that was the main thing I remembered, right? Obviously, I was getting very intensive treatments and studies and evaluations done, but that was the thing that really stuck with me. So pulling forward, and by the way, she eventually did get into pediatrics residency in my program. She ended up doing pediatric neurology. It was quite interesting that later on I was her fellow, so her senior, when she was a resident in pediatrics. Nevertheless, the taking that experience into account brings me, again, a lot more of this. What's the most important thing in medicine? Obviously, taking care of the patient. You give the medicines, you give whatever tests are needed, whatever surgery is needed. These things are obviously going to be vital to the success of treatment. But when it comes to the actual experience that the patient is having, it doesn't have to be miserable. It doesn't have to be simply, I am here, here is a medicine, here is a surgery, we will do the thing, you will get better, you will be feeling better. Nope, don't joke with me. This is serious talk. We will focus on exactly what we are doing. It's too much to be doing that. It's not really helpful, I found. And again, my own personal experience, I really, really remembered the fun, the levity brought to the situation. So in real life medicine that I practice every day now, pediatric oncology, one of my big things is that I don't want to walk in the room with a sickle and a big robe as like I'm the Grim Reaper and I'm walking in and telling you, oh, hey, this is the end of the world. Your child has leukemia. Obviously, that's the stuff going through your mind. Obviously, I know where everyone's mind goes. But I, as the doctor, knowing all of the data and outcomes with many patients that we've been seeing in the past few decades, it's a lot easier for me to be playful with the kids, make the kids a little bit less frightened, because of course, if the parents are frightened, the kids are frightened. Make the kids a little bit less frightened, and it makes things go a lot smoother in the long run, and hopefully makes the treatment process not terrible. Now, of course, there is data to support all of this, and I'm not going to go through all the details of this data, but this one was particularly interesting to me. It discussed the effectiveness of hospital clowns for symptom management in pediatrics. And this was talking about both cancer related therapies and other therapies, intensive care unit stays, et cetera. And so this says studies showed that children and adolescents who are in the presence of hospital clowns, either with or without a parent present, reported significantly less anxiety during a range of medical procedures, as well as improved psychological adjustment. And 3 studies that evaluated chronic conditions showed favorable results for the intervention of hospital clowns with significant reduction in stress, fatigue, pain, and distress. In other words, people feel better and therapies are more effective when you have some levity in the way that you treat a patient. This, again, was specifically to pediatrics, but there's lots and lots of studies that are out there that show that even in adult patients, even in that crotchety old man who's, and having his ninth heart attack, that bringing some levity to the situation makes the treatment more effective and more pleasant for the patients. And again, I have a whole slew of these guys. Um, in real life, how do we use this? How do we put this into effect? Um, number one, me personally, I know, see, I skipped over. My in real life, my approach is that I walk in the room, I want to play with the kids. I'm going to joke with them. I'm going to make sure that they understand what they can understand. Again, if you have a 2-year-old, they're not probably going to understand too much about what I'm talking about when I say the word leukemia or I say the word chemotherapy. They don't really understand that. But of course, they understand, oh, look at this. Here's a nurse that's coming at me with a needle. That is frightening. I am scared. I could do my best to make them less frightened. I'll joke with them. I'll play with them. We obviously have lots of other people in the hospital who are going to play and interact with these kids. Um, for the older kids, I do like talking to them and giving them information. I don't like a lot of times I'll get a consultation and the consultation question will say, there's a concern that a patient has a lymphoma, let's say. And the physician asking me to come meet the patient will say, hi, can you please come see patient in room, 273 or whatever. Um, they don't know that you're the cancer doctor, so don't tell them. Obviously, I'm the cancer doctor. If you're calling me about a cancer question, I'm going to go in there and tell the family that that's what I'm talking about. But I don't have to be mean about it. I don't have to walk in and say, hey, cancer, life is over, everything's terrible. That's not the case. So I'll walk in there and I'll explain to them in full detail and I will play with them and joke with them and make light of the situation. And if they, play on TikTok all day, I'll say, oh, look at this, we're playing on TikTok. This is like what you see in TikTok and all those sad videos. Um, but the point being that there's no need for me to walk in that room and be all serious all the time. It doesn't help anybody. And in fact, there's good data to suggest that being joyful and pleasant and joking and playful will help better outcomes for the patients. So in real life, how do we do it in our hospital? Obviously, there's us. And as you saw in one of those earlier pictures, which actually I'm going to pull back up just because I think it's fun. Um, this, oops. Picture on the bottom left is the pediatric oncology team at Jersey Shore University Medical Center, minus Dr. Foti, who started with us shortly after that picture was taken. And you see, we bring playfulness, joy, happiness to our patients because in real life, that's what they need. And of course, when it's time to be serious and talk about really serious issues, we of course talk about them. We have child life specialists. We have a great musical therapist. We have great play therapy. We celebrate everything. If it's a birthday, if it's a graduation, if it's end of therapy. After my research into Patch Adams, I will say hospital clowns seem to be beneficial. We don't have one at Jersey Shore, but that would be great. Pet therapy is really nice. We have a lot of nice interactions with our patients and animals that come around that I guess their owners technically volunteer them to play and they come in. That makes for a good time, especially kids who are in the hospital for extended durations of time. They get real excited when they get to play with the little doggies. Toys and donations, that's something that I didn't mention before, but we at Jersey Shore have a whole bunch of charitable groups that donate toys. So you come to the doctor's office, you get whatever thing is frightening the child, blood draw, discussions, anything that's frightening to them. And then afterwards they come in and they get a toy with us and they get a little bit of smile on their face and we'll play with them. The other stuff, of course, so I'm talking about non-medical provider interactions. But it's very important. We have a great cafeteria lady, actually, one of the food delivery women. And she comes in and she's always wearing like all these little patches and she plays with the kids and she jokes with the kids. So even non-clinical staff, very, very important to the success of treatment because again, having the patient not be miserable all the time has data supporting better outcomes. So again, even small things like that are super important. Obviously, the parents and the family are going to be super important. And it was just discussed a little bit ago about the Leukemia Lymphoma Society and their supportive measures for parents because parents are vital in the treatment of the patient. And again, the parent feeling okay and manageable with their emotions can help the kid feel better about their emotions. And then finally, the patients. Obviously, one of the nice things for me is I get to experience longer term treatment or time spent with each patient. So I get to see them grow up a little bit. And with something like ALL, which is the most common type of leukemia, um, I'm with those patients for something like 2.5 to 3 years. It's wonderful watching them grow up from being these little, sometimes as young as 1 year old, even younger than that, to being toddlers, being little kids, even sometimes being teenagers as I follow them out after therapy. The patients are really what drive this. And I think that it's important for us as providers and for parents and for friends, everybody to be involved and to make sure that the kid is able to have fun because you don't need to be miserable all the time just because you have cancer. In 2024 and soon to be 2025, cancer is a treatable condition and many, many patients are cured of their disease. So you don't need to be miserable about it all of the time. And in fact, play, happiness, humor is a huge part of making sure that the treatments are effective.
He has kindly agreed to join us today to share briefly a little bit about his family story, specifically about how he uses Dr. Silverman, let me start again. So he worked with Dr. Silverman during Danica's treatment and diagnosis of ALL in January 2023. So he's going to talk briefly about how Dr. Silverman's approach and their family's use of humor as a coping strategy has helped them during the challenges that their family has been facing.
Thank you very much for that. I appreciate the introduction. I'm so thankful to be on this with you guys and to share the stage with the great Dr. Silverman, as my daughter calls him. A little context. My 2-year-old daughter, Danica, was diagnosed January of 23. She's still in treatment. And in that time, actually in the first year alone, we spent over 100 nights in the hospital. So seeing our oncology team, the all-star team that they are, Dr. Silverman, and Dr. Skirbo, Marianne Lacey, they were very much a functioning part of our existence there for quite some time and still are. I mean, we can call it any time and they're always right there. But the one thing that really stood out, like Dr. Silverman touched on, and I felt like when I called him Patch Adams for the very first time, I felt like I was the first person to ever say that, but obviously I am not because it's kind of his shtick. But knowing that he definitely infused a lot of humor those first couple of days, those first couple of weeks, and ultimately those first couple of months into their relationship. And I love it because I love a good awkward moment. And Dr. Silverman definitely owns a lot of quality comedic awkward moments. And I enjoyed watching the doctors near him squirm a little bit when he would say stuff. Dr. Skirbo has this patented walk backwards move that she has when she's working with him sometimes. So I love that. And honestly, the Patch Adams things, I thought I started it, but then, he actually came in with the red nose for himself and my daughter just a few days later, a few Amazon days later. I don't know if he had them in his closet or if they were just delivered, but he fully owned it. He's definitely infused a ton of humor into a lot of situations. I mean, one of the scariest moments for my wife was when my daughter was getting sedated. And that was kind of his moment. He was a full out gritty dancing. I mean, he's got some skills. He dropped some moves on you. Danica laughed hysterically. And it made things a lot easier. I mean, that power of positivity and just the energy in the room, it wasn't doom and gloom. It was, it was good energy. And that's what I needed, me specifically. And that's why I'm on this call as opposed to my wife. My wife is a little more data driven. She needs to know the facts. She wants to know everything. She wants to hear the worst case scenario. I just want to, be the positive. I just want to be able to lift things up, put things down. I'll carry her wherever you need me. I'll lay in her bed with her, but the details wasn't my strong point. And Dr. Silverman really helped diffuse that for me. While the other doctors were providing details to my wife and sharing what needed to be shared, they're a fantastic team. And he actually spread that humor around. Dr. Skirbo, unfortunately, his partner in crime there, she's unfortunately a Miami Hurricane, and she took the I'm a Florida State guy and we're arch enemies, and she took the humor and littered our room with Miami Hurricane stuff one night when I came in. I spent overnights there a lot of times, and stickers everywhere. Even my daughter was in on the joke. She had a University of Miami sticker on her forehead. Just own the joy, and it made it a very comfortable place for me as a parent. I think humor plays a huge role in healing. I think humor, I mean, the power of positivity for me, I mean, our brain is our strongest organ. I mean, I can't tell it to a group of doctors anymore, but I do believe that when my daughter was in a good mood, and you saw those slides a few minutes ago, what it does and how it's been clinically proven, I it's all about that. And if we can keep it positive, our daughter picks up on that energy. She knew when we were nervous. She knew when we were scared. And we did our best. I mean, we didn't even use the word cancer. We didn't use the word leukemia. We didn't use those words. We used the word super medicine. We used to use vitamins. We used the word, you got to take your super medicine. And honestly, Danica and Silverman can attest to this. She developed some superpowers taking all her chemo meds where she can put her arms out. Yeah, and she has power to like force you across the room through this unbelievable imaginary motion. And I mean, at one point, I think it was Marianne or maybe Lacey fell into the paper towel dispenser. All the paper towels were coming out. Dr. Skirbo was slid down many a wall, getting forced into the wall by my daughter. I flipped over beds. I mean, it's a routine and it's quite the commotion. And you kind of got to taper yourself a little bit because you are in the pediatric intensive care unit. I mean, so you can't be like having a comedy fest in the corner there. But we definitely brought some smiles. He brought some smiles. The whole team brought some laughter. And it gets lonely when the hospital is your second home. So it's really, really important to find the humor and the things that, I mean, it's a different environment for Danica. We controlled that environment, and Dr. Silverman, led with the funny nose and the patch things. And, there was definitely more laughs than we would have ever expected in the environment we were in. And, we're thankful for that. It's a huge part of the success, and we expect a full recovery for Danica. And the knowledge that this team brought to this oncology team brought to this, and with the fun and the laughter, it was paramount to our success, and we're so forever thankful for what they've done.
Thank you, Justin. I really appreciate that. And we will all keep your family in our thoughts and prayers. Thank you for sharing your story. And I think for other families on this call, many can resonate with what you said, especially that some parents have one role and another parent has a different role within the situation, if not just leaning on our strengths as we are all having to develop our own coping strategies in these tremendously challenging situations. And to Sarah's point, it's not something that you develop overnight. This is something that it takes a team of people, it takes reinforcement, it takes practice, and it's going to be personalized to your own family, your own child's diagnosis and situation. So this is not prescriptive for everyone on this call. We understand that, but it is something that we hope you take a little nugget away from something that you heard today that works for you and your personality and your strengths and your comfort level and your family and the situation you're in the moment. And I hope that your treatment team, maybe you feel comfortable to share something or just emulate some of how you would like the dynamic to be in the space around your child and see how the healthcare team responds to that. So thank you for having the courage to share. And because of time, we did have some great questions. So I would like to just invite people who would like to stay for a Q&A. We can stay on a little longer at 2:30. But right now, we're going to stop for a moment. Originally, this was planned for the end, but with time, we're going to have Sarah Ann come back on, introduce our surprise guest. And then at 2:30, we can, of course, just see if there's anyone still here who wants to have some Q&A, if that's okay. And if not, we'll close out after that. So approach when you know that people are hurting. And so the question was, how do you handle being the class clown? This is for them. They're asking on behalf of themselves. So how do I handle always being the class clown for all your cancer brothers and sisters, but you are dying inside? So I think either of you might be able to speak to that, but I think this speaks to the challenge of really being in pain, but trying to be a light for your family and those around you. So if you both want to just take a minute to share your perspective on that, and thank you to the person who had the courage to ask that question.
Yeah, I would say it's a different role to be the physician than it is to be the patient. From my perspective, when I have patients who are in really dire circumstances, it is obviously going to be challenging to just come in there and play and joke and be all, everything's fun, But from the perspective of the physician in that room, I'll take the moment to be joyful with the child. All my patients are children, so it's not like my patients have full in-depth, like, oh, child is going to have this problem, so I'm gone. There's a different level of the thought process to it. But to me, a lot of it is in the moment where you need to be serious, you do need to be serious. And if you are the patient in this circumstance, again, I'm not speaking as a patient beyond my own experience as the patient in a less severe disease state. Um, it's important. One of the big things that Sarah actually talked about was sort of taking the moment to yourself to absorb, oh, hey, this is a bad situation. I'm frightened. There are things that I'm concerned about, and I don't like this, but I need to be strong for my child. And so we're gonna brush it away kind of thing. Not now, not now. Sorry, I'm getting the correct mantra wrong. But obviously you need to take time in your own mind to get yourself in a better place. But making that show of, hey, actually, we're going to get through this. I'm here to support you. I recognize things are challenging and difficult right now, but it's something to strive towards, um, you know, within what you can do. That's really what you have to try to do, and it's challenging. I will accept
Thank
that.
you.
May I
Thank you.
answer that? I
Yeah, sure.
build
Yeah.
off. When I said that it's really important that you take that pity party time and you take that morning time, it's really important. There was a really interesting article about being a patient and how you navigate the world around you. And it speaks to this. And I actually did a podcast episode on it. So I'm going to quote it without quoting the journalist that wrote the article because I can't remember her name. But if you go to Beating Cancer Daily, I think it's called Cancer Hugged or Cancer Caregiver. I'm not sure. Anyway, basically what it said is there are three things that you need to train the people around you to know. And I added a fourth, but it was you either want to be heard, you want to be helped, or you want to be hugged. And they're not mind readers. So if you can have a very honest conversation with the people around you, and I added humored to it. So I have four H's. But if you can say to them, look, there are times when I'm going to need for you to hear me and not try to solve everything. I need you to hug me, or I need you to help me, or I need you to have fun with me, humor me, or have fun with me. If you can set up that communication, that takes a lot of burden off you to be the rallier of everyone around you, and it lets you conserve your energy for other things. So I think it's a communication situation. And then I know that, you are trying to be the brave one because you don't want people to be scared or you don't want people to be worried, particularly if they are your kids or your parents. But that those strategies can be learned. So it's meditation, it's ways that you can discharge a lot of that emotion through the strategies that I taught here, but also the strategies that we teach every day on the podcast. You have to put your life mask on first, or you can't help your child or everyone else that's demanding you.
Thank you. It's great. And then a final question. This is for Justin. Do we still have Justin? Oh, yes, we do. Okay. So, Justin, when Dr. Silverman was being silly with you or your child, what was your first reaction?
Who is this dude? Nah, it was popular. Like I said, I truly enjoy a nice awkward setting, and Mr. Silverman, Dr. Silverman, like to bring that nice flow to the room. It was I said from the get go he was my favorite just because he came in. Yeah, sorry, Dr. Skirbo or Lacey or Marion if they're on, but my wife has her favorite, so it's a split decision. So sorry you didn't make that top, but yeah, I knew we would have a bond, and he definitely he made my stress level go down. I mean, he single handedly made it easier for my daughter, made it easier for me, And that was 2/3 of the pie. So he did a phenomenal job. And the rest of the team picked up my wife and educated her and answered all her calls and answered all her questions. So it was a good balance. They're a great team, and it balanced out well for our particular parent group here. And even my mother-in-law thought he was funny. My mother thought he was funny. Yeah, it was just an overall. But when we wanted seriousness, he kind of had to defer a little bit. He knew the answers, but he deferred to the other team to kind of go ahead. And while he was distracting Danica, it works out well.
Thank
And
you. Thanks for sharing.
I
Yeah.
can say one more thing. This was taught to me by Michael Christensen. I don't know why that's, I'm on the wrong, can you,
We can
hear
see
you.
it.
okay.
Yeah.
This was taught to me by Michael Christensen from the Big Apple Circus. And because they used to run all the clown care units, they were in at least 11 hospitals. And he said to me, Saren, never walk in a room trying to be funny, trying to save someone, trying to, heal someone. He said, go to the door, leave your ego at the door, take a deep breath, and just that 1 second to really observe the situation, and the patient will tell you the entry point. And that takes a lot of confidence and a reduction of ego, not to try to fix or make everyone laugh their heart out. There's something very still about it. And people don't think of clowns or comedians or doctors wearing funny noses as being still. But it's in that stillness that you really, really see how you can unfold that situation that's at the right point for that patient. And then the other thing is that the charity, because we do have the laugh line, because we do have the podcast, because we have the wellness joke book programs and all those videos on our website, it's a very soft touch to hand it over to somebody and just be like, hey, did you hear about that website or that laugh line or that joke book? Or it's a very subtle way. And if they want to receive that pass or come back to you with it, or the tumor humor challenge, it's a very comfortable way for people to introduce this idea of therapeutic humor and play in a very soft touch.
Thank you so much for sharing. I love all these strategies. I do hope people in the audience that are still here, thank you for being here and for staying on a little bit. I do want to close this by telling you something that was written in our Q&A. It says, as a parent, I always knew that humor was helping my son in the hospital, but I was most grateful to finally talk to other parents who, in a way, gave me permission to laugh. It didn't mean I cared less. Laughter is a release. So I just want to say, if that helps anyone else in the call, listen to that, but also for our speakers, thank you for sharing. It's clearly impacted the audience that was able to come today. Thank you all for being here. We're going to close out. I do want to let you know that in your follow-up email, you are going to be invited to our next pediatric program that is happening and this is where the tech person is my best friend. This is going to be on March 12th at 1. It's called The Power of Conversation, Helping Families Communicate with Your Care Team. You will all be invited. The registration site is open, so that will be in the follow-up email. So thank you everyone again for being here. To our speakers, thank you for being here. Wonderful job and information. And I hope you have a great holiday. Take care, everybody. Bye-bye.
Thank you.
Thank you. Bye, everybody.
Thanks for what you do, doctor.